does the EKG relate to the cardiac cycle? The EKG consists of three components: your P wave, your QRS wave, and your T wave. Each wave represents an electrical event. For example, the P wave represents atrial depolarization, QRS represents ventricular depolarization, and the T wave represents ventricular repolarization. Essentially, each electrical event is then followed by a mechanical event of the cardiac cycle. For example, the P wave, starting with atrial depolarization, will correspond then with atrial systole, where the atria contracts and blood flows from the atria to the ventricles. The QRS wave indicates ventricular depolarization. In terms of the cardiac cycle, you first have isovolumetric contraction, where temporarily all four of the heart valves are closed. This increases right ventricular and left ventricular pressure. Right ventricular pressure has to exceed pulmonic artery pressure, and left ventricular pressure has to exceed the pressure in the aorta. Once this happens, the pulmonic valve and the aortic valve will open to allow blood to get ejected, triggering ventricular systole. The T wave indicates ventricular repolarization, and in terms of the cardiac cycle, this means ventricular relaxation or diastole. This means that the semilunar valves have closed, and now the atrioventricular valves have opened, allowing for the ventricles to fill again.